Malaria. Malaria is an acute febrile illness caused by Plasmodium parasites, which are spread to humans through the bites of an infected female Anopheles mosquitoes. There are different species that cause malaria in humans, namely the Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. Among these species, Plasmodium falciparum and vivax pose the greatest threat. The incubation period of malaria is within 12 to 30 days. Incubation period is the time between exposure to an infection and the appearance of the first symptoms. Clinical symptoms of malaria include coughing, fatigue, malaise, shaking chills, arthralgia or joint pain, myalgia or muscle pain, and lastly would be a paroxysmal fever characterized by shaking chills and sweats every 48 to 72 hours. Malaria signs and symptoms typically begin within a few weeks after being bitten by an infected mosquito. However, some types of malaria parasites can lie dormant in your body for up to 1 year. Diagnostic exams for malaria. Number 1. A complete blood count or CBC. CBC checks for anemia or evidence of other possible infections. Anemia sometimes develops in people with malaria because the parasites damage and destroy red blood cells. Number 2. An electrolyte panel exam. Electrolytes play an important role in the normal functioning of the human body. Electrolyte imbalance, mineral disturbances are the common clinical manifestation in several infectious diseases, including malaria. Electrolyte levels of sodium, potassium, calcium, and magnesium are monitored for this exam. Third, a renal function test. This is to check the severity of malaria, which may affect the kidney functioning. Number 4, a urine and blood culture are related to determining the presence of the causative agent. Number 5, thick, thin, and a peripheral blood smear to assess the characteristics and features of the red blood cells under a microscope. Sixth, chest radiography and CT scan to check for the severity of malaria, which may affect other organs of the body. And lastly would be an antigen detection method, which is still under development. For the medical management of malaria, first, we administer anti-malarial drugs to our clients. Examples of these drugs are the artemether 20 mg and lumefantrine 120 mg or the Coartem. We also have the mefloquine or the Lariam. Anti-malarial drugs are used for the treatment and prevention of a malaria infection. Most anti-malarial drugs target the erythrocytic stage of malaria infection, which is the phase of infection that causes symptomatic illness. Antipyretics may also be given to treat and manage fever. Several antiprotozoals may also be given to clients diagnosed with malaria. Please familiarize yourselves with these common medications. In general, antiprotozoals are used to treat protozoal infections, which include amoebiasis, giardiasis, cryptosporidiosis, microsporidiosis, and of course, malaria. These drugs kill or inhibit the growth of organisms known as protozoans. Protozoans are mainly the cause of malaria. For the nursing management, our main goal is more focused on the prevention of malaria. Proper and timely assessment and monitoring for any bleeding symptoms may prevent complications of malaria. Lastly, we administer anti-malarial and anti-protozoal medications together with other supplementary regimen for symptomatic treatment. Bullous diseases or the blistering disorders. A blistering disease is a condition in which there are fluid-filled skin lesions. It is a chronic disorder that results in the development of bulla or bullae. In this condition, the vesicles are small in size, less than 5 millimeters in diameter, and the blisters may break or the roof of the blister may become detached, forming an erosion. This condition is highly increased to Jewish and Mediterranean people and also common to middle and older adults. Here's an actual picture of the bullous or the blistering disorder. This condition is associated with other autoimmune disorders and may be due to the use of penicillamine and captopril. Use of such medications may have a severe reaction to one's integumentary system. We have three types. Number 1, the most common type, pemphigus vulgaris. Second type, pemphigus foliaceus. And the third one is the pemphigus erythematosus. We'll discuss the most common type of a blistering disorder, the pemphigus vulgaris. This condition mainly affects the oral mucous membrane. This is caused by the immunoglobulin G antibodies and the HLA-A10 antigen. Both of these materials play a vital role in maintaining our skin integrity, particularly our epidermal layer. The process of ancatholysis is also evident in this condition, in which the epidermal layer could be disrupted due to the autoimmune reaction. Common cause of death of individuals with this condition is septicemia or infection to the bloodstream caused by Staphylococcus aureus. How do we describe the blisters in this condition? The blisters appear first in the mouth and scalp, then to the face, back, chest, the umbilicus, and then towards the groin area. It follows a downward direction. The blisters usually form in the epidermis due to the process of acantholysis in the said layer. The process of acantholysis causes the epidermal cells to separate above the basal layer, which then increases the risk for the cells to rupture and form crust. Oozing fluids with musty odor can also be observed. And lastly, the lesions are described to be painful. Please take note of this important and pathognomonic sign of pemphigus vulgaris, which is the Nikolsky sign. This sign is elicited upon the application of pressure on a blister, which then causes it to spread to the adjacent skin. Here are some very specific diagnostic exams for pemphigus vulgaris. First is through an immunofluorescence microscopy exam. Its purpose is to identify immunoglobulin G antibodies in the epidermal layer and in the blood. Another one is through a skin biopsy to determine the presence of acantholysis. And last would be the chunk test to assess the fluid of the blister to help in the identification of an acantholytic cell. The goals of treatment for this condition is to control the severity of the disease, prevent development of other types of infection, prevent loss of fluids or dehydration, and lastly is to promote the integrity and healing of the skin. The last but not the least condition to be discussed is HIV and AIDS. HIV or human immunodeficiency virus, the causative agent for the condition of AIDS. HIV is a retrovirus. It is called a retrovirus because it works in a back-to-front way. Unlike other viruses, retroviruses store their genetic information using RNA instead of DNA, meaning they need to make DNA when they enter a human cell in order to make new copies of themselves. HIV is transmitted through the following. Number 1, sexual intercourse with an infected person. Second, exposure to an HIV-infected blood and other blood products. Number 3, it can also be transmitted through perinatal transmission upon delivery. And lastly, through breastfeeding. An HIV infects cells with CD4 receptors such as lymphocytes, monocytes, or macrophages. HIV cannot replicate on its own, so in order to make new copies of itself, it must infect cells of the human immune system called the CD4 cells. CD4 cells are white blood cells that play a central role in responding to infections in the body. HIV also primarily causes damage to and destruction of the CD4 plus T cells, in which more CD4 receptors are present. Lastly, the CD4 plus T cells play a key role in the ability of the immune system to recognize and defend against presence of any pathogen. We have the term viral load. An HIV viral load is a blood test that measures the amount of HIV in our blood. This viral load is considered at a high level during the first 6 months of infection and during the late stages. These are the 4 stages according to the CDC, or the Center for Disease Control and Prevention. Stage 1, the primary infection, or acute HIV infection, or acute HIV syndrome. Stage 2, the HIV asymptomatic, or the CDC category A. Stage 3, the HIV symptomatic, or the CDC category B. And the last stage, stage 4, the AIDS, or the CDC category C. Here are the common clinical manifestations of HIV/AIDS. Please familiarize yourselves with the following signs and symptoms. Diagnostic tests for HIV/AIDS. First is through an EIA, or an enzyme immunoassay, or through an ELISA, enzyme-linked immunosorbent assay. These exams are used to detect the HIV antibody. It checks for certain proteins that the body makes in response to HIV. The blood sample will then be added to a cassette that contains the viral protein called an antigen. Second is through a Western blot exam. The Western blot exam separates the blood proteins and detects the specific proteins called your HIV antibodies that indicate an HIV infection. The Western blot exam is used to confirm a positive ELISA, and the combined tests are 99.9% accurate. We also have the viral load test, which we have discussed earlier. This is to assess the levels of HIV in our blood. Then lastly is the CD4-CD8 ratio exam. The CD4-CD8 ratio is one of the blood tests used to monitor our immune system if we have HIV. It compares the proportion of so-called helper CD4 T cells to the killer CD8 T cells, and the value of which can help predict the likely course of the disease. For the medical management, clients who are HIV positive are given with two types of medications. We have the NRTIs and the NNRTIs. The NRTIs, or the nucleoside analog reverse transcriptase inhibitors, become a part of the HIV DNA, which aims to derail and disrupt its building process. Most common example for this type is zidovudine. On the other hand, the NNRTIs, or the non-nucleoside reverse transcriptase inhibitors, these attach to reverse the action of transcriptase, thus preventing the conversion of HIV RNA to DNA. Most common example would be etravirine. And for the last slide of this module, the nursing management for clients who are HIV positive. First, we need to focus on health education. Health education and how to manage symptoms and to prevent the condition to a later stage. Second, to prevent further infections, since the immune system of these individuals are already compromised, thus increasing the risk to be infected. Third, controlling fatigue and promoting energy conservation techniques and activities. Fourth, we may also refer our clients to support groups to enhance their coping. And lastly, we need to promote effective therapeutic management, particularly on medication compliance, to better the condition. That ends our review on the care of clients with inflammatory and immunologic disturbances. I hope that I have shared to you important and vital information to supplement your preparations for the upcoming board exam. I also hope that you were able to grasp something that you can apply in your daily life. Always remember to keep our immune system healthy at all times. This will protect us in any kinds of disease or condition. Stay healthy always. See you on our virtual meeting. Once again, this is Mr. Benedict Duargilipitan. Thank you and God bless Level 4.